Welcome to your screencast discussing the bones of the pelvis, where we will learn about the hip bone known as the os coxa and the sacrum and coccyx.
I'm going to start off with our hip bone, which is also known as our os coxa. I've taken this image from a Frank Netter atlas, which just has a bunch of various anatomical images, including all of the images you'll see in this lecture. So before the age of really 18 to 21, our hip bones are actually three separate bones, and this is going to include the ilium, the ischium, and the pubis. So let's talk about each one of those bones individually. We'll start off with the ilium, and I want you to notice that this view here is a lateral view. So think about the outside portions of your hips. So if you kind of put your hands on your hips, it's that side over there. Whereas this view here is our medial view, and this side of the bone is facing inward toward all of your pelvic contents. Okay, so now that we got that situated, let's talk about these structures. So the first thing you have listed there is the iliac crest. And remember I asked you to put your hands on your hips? This is that ridge that you're feeling when you put your hands on your hips. And if we go to the anterior portion of that iliac crest, we're going to see that there is a bump there, and you can see that in green. This bump you can also palpate on yourself. If you put your hands on your hips, toward your fingers where you feel that big bump in the front, that's your anterior superior iliac spine. And this structure is just really describing the location of where this bone marking is. It's the anterior side. There's a superior one because soon we're going to talk about this inferior one. Iliac because it's on the ilium, and spine is referring to the nature of the shape of this bone marking. So it's kind of like a outgrowth of bone here. And below that we're going to find our anterior inferior iliac spine, and I've abbreviated these for you too so you can kind of speak quickly or write them quickly. But for your examination, practical exam 3 that you'll see this on, I want you to actually write everything out. Now if we go to the posterior side of our ilium, you're also going to see a posterior superior iliac spine, and sometimes you can palpate this or see it really well on others. If you've ever noticed on someone's lower back that there's almost two little dimples in their lower back, this is this posterior superior iliac spine, and there's no muscle really sitting in between the skin and this bone, so it kind of pulls that skin in and it creates a dimple. Below that we have the posterior inferior iliac spine that you see outlined in orange. Now if you go below that posterior inferior iliac spine, you're going to see this big notch, this big dip within the bone, and this is called the greater sciatic notch. And yes, it was named so because the sciatic nerve exits through here. So we'll take a look at that and the sciatic nerve in the cadaver lab. Now we're going to switch back to this medial view in order to see this auricular surface for sacrum. Careful not to say articular surface for sacrum. This was named auricular because it's shaped like an auricle, like an ear. So this is a great structure to find on the os coxa, and you'll immediately know that this is my medial view of this bone. Although we say for sacrum because the sacrum actually does articulate here. So there's a little bit of confusion with this. Next thing I have listed for you is the wing or the ala, and that's really this entire, let me see if I have it marked here. It's really this entire portion all in here. So it's this part that spans on out. It's like the wings of our pelvis, okay? And then here you could see, well, where the sacrum is coming together with the ilium. And then our pubic bones are touching one another here. Okay, so on this wing or ala, we're going to have two different surfaces. On our medial surface, it'll be nice and smoothed out. So this is the iliac fossa. The term fossa means a shallow depression. So it's just a shallow depression, just how we saw on our scapula. We had that supraspinous fossa. They were all shallow depressions. Whereas on our lateral view, we're going to see these lines, and I'll kind of outline them for you. Ooh, sorry about that. There we go. We'll see these lines. There's our anterior gluteal line. There's a posterior gluteal line and inferior gluteal line. Don't worry so much about those lines, but look for some lines on the back, on the lateral side here, to know that this is our gluteal surface. It's where our gluteal muscles are going to originate from. And the last thing you have listed here, you're going to see on a medial view of the os coxa, and that's going to be this roughened area. Oh, my animations aren't working well. This roughened area here, right superior to this auricular surface for sacrum, and that's going to be the iliac tuberosity. If you remember back from our first lab list screencast, anytime you see that word tuberosity, it means a roughened or perforated bump. Okay, so now let's jump into our second bone of the os coxa, and that is the ischium. Our ischium has a tuberosity as well. So if you take your hands and put them on your rear and sit back down, you're going to feel two bumps that you're sitting on within each cheek, let's say. So this is your ischial tuberosity, also known as your sit bone. If you're into yoga, they always talk about your sit bone or sits bone. It's this one here. It's your ischial tuberosity. Also, this is where your hamstrings are going to originate from. Next, we have your ischial spine. It just is lower than your greater sciatic notch that we identified earlier, and it sticks out like a thorn. Okay, your ischial spine or spine of the ischium. And so below that area, we have another dip. Oh, I only identified it on the lower one, but I'll point it out with my arrow here. Right here is your lesser sciatic notch, and we're going to have some other nerves coursing through here that we'll talk about in your nervous system. So I always like to kind of go through in a line back here to describe structures. Here's your PSIS, PIIS, greater sciatic notch, ischial spine, lesser sciatic notch, and then you have your ischial tuberosity. So you can kind of memorize them in a row like that if that helps. Okay. Next part, it can also be a little bit challenging for students. So whenever you see this word ramus, it means branch. And we have two portions of our bones coming together here. We have the ischium coming together with the pubic bone, excuse me. And so when they come together, this area, this entire thing, is known as the Ischiopubic Ramus. This entire thing. If I have a mark here, more on the ischial side, you would identify this as being the ischial ramus, because this is the ischial part of the branch of the Ischiopubic Ramus. So there's your ischial ramus. Okay, and then we'll talk about the other parts when we discuss your pubic bone. So this arrow represents the Ischiopubic Ramus because we're including both the ischial bone and the pubic bone. Okay, so let's move into the pubis. Now, if we look at this medial view, we are going to see the symphyseal surface. And this is that portion that is going to come together with the other os coxa. So I'm going to go back real quick to this image. So right in here would be where your symphyseal surface is, and it comes together with the symphyseal surface of the other os coxa and creates the interpubic joint. And remember, this joint will only move during childbirth. So sorry guys, your interpubic joint hopefully will not move unless it's due to injury. Okay, so let's go back to that. Here we go. that symphyseal surface. Now, if you look above that area, you're going to find that, oh, I forgot to put an image in here. So here's your pubic symphysis, and you can see we have a ton of ligaments holding that in place as well. Okay, moving on to our next term will be the pubic tubercle. So if you look at the symphyseal surface and look right above it, there's a sharp bump here, and that is called your pubic tubercle. You can see that on the lateral view as well. All right, now for more rami. So this pink portion here is known as your superior pubic ramus, and below that we have a inferior pubic ramus. So this would also be the inferior pubic ramus. Now our superior pubic ramus does not have any part in the ischiopubic ramus. This is a completely different part. However, this inferior pubic ramus is a part of the ischiopubic ramus, this entire branch. So I could say inferior pubic ramus plus ischial ramus equals ischiopubic ramus. Oh, and I have that slide for you right here. There's our ischiopubic ramus, there's my ischial ramus, and there's my inferior pubic ramus. Cool. Okay, now we have a structure that's created by all three bones, the ilium, ischium, and pubis all together, and that is the acetabulum. Acetabulum was actually named so after acetic acid because they used to use a ladle to scoop out vinegar from the barrel. And so anatomists thought, oh, this looks like a ladle shape, which it's very deep, like a deep pocket for the head of the femur. And so they named it acetabulum. So we find this on the lateral surface only. It is made up of those three bones, and they fuse together between the ages of 18 to 21. And like I said, the head of the femur is going to articulate here. Now there are two different parts to the acetabulum. Okay, there's our view of the head of the femur articulating with the acetabulum. Okay, so there are two parts here. This opening portion here is known as the notch or the acetabular notch. And then the moon-like surface is going to be known as the lunate surface. And we have a hole here, so we're going to use the term foramen. So foramen means hole, but obturator means to stop up. And that's because we have a membrane. That's the hole there, but the membrane kind of goes across like this. This obturator membrane stops up or closes up this hole. So the obturator foramen is created by two bones. You can see it's kind of encirculated by the pubis and the ischium. That brings us to our sacrum, and we have a base and apex. Now base is always going to be the most broad portion of a bone, and an apex will always be the most pointed portion. So there's our base, there's our apex. And we have two different surfaces. We have that smoothed out portion of our sacrum. This is going to be our pelvic surface, whereas the bumpy, roughened area, that's going to be our dorsal surface or the posterior surface. So pelvic surface, this is anterior, dorsal surface is posterior. Now if we switch back to our anterior view, we could see the promontory here, and it's just this little edge of the lip where your intervertebral disc L5 would be sitting on top of. We also have superior articular processes and facets, so we're seeing this in a posterior view. This is going to articulate with an inferior articular process and facet of L5. That's never going to change unless there's something that is atypical about someone's anatomy. Now, our next two terms, you might notice the word foramina in there. And if you remember the word foramina, that means many holes. So we have on our anterior view, anterior or pelvic sacral foramina, And on the back, we have posterior or dorsal sacral foramina. And every quarter that I teach this, someone always asks, well, how come we have two different names when it's one whole? And the reason for that is because we have all of these wonderful nerves that are going to be exiting either anteriorly through the anterior sacral foramina or posteriorly through the dorsal sacral foramina. And so we need to differentiate those exits. And the last thing we have on our list here is the sacral hiatus. If you go on a hiatus, that means you are kind of missing, you're out on vacation, you're not around, right? So that's actually what's happening here. We say our sacrum are 5 fused vertebrae, and once we get to that 5th fused vertebrae, the lamina actually on this vertebrae did not completely fuse together. And that's why we have an opening here, which is just fine because we are going to have some ligaments coming down from this area and also some spinal nerves. And lastly, we have our coccyx, which can range from 3 to 5 fused vertebrae, but typically it will be 4 fused vertebrae.
So there you have it. That is the end of our screencast.